Welcome to the Healthier Pregnancy Presentation Series. I'm here with Dr. Ann Borders from the Department of Obstetrics and Gynecology, Division of Maternal and Fetal Medicine at Evanston Hospital, North Shore University Health System, and the University of Chicago Pritzker School of Medicine to discuss the Affordable Care Act covered preventive services of interventions to promote breastfeeding. Thank you for taking the time today to come in and talk about this very important topic. We'll be discussing today why providing counseling and support for breastfeeding is so important, common barriers to successful breastfeeding, evidence-based interventions to improve breastfeeding success, and ways to help women reach their breastfeeding goals. And also how providers can best support women who are trying to reach those goals. So let's begin by discussing a little bit about your background.
Thank you, Shirley. Well, it's really wonderful to be here. I'm excited to be talking about breastfeeding and excited to be here to share more details really about what providers need to know. I think that's the key takeaway. I am a maternal fetal medicine physician. I practice at Evanston Hospital, and I have done research in the area of breastfeeding as well as helped start breastfeeding peer counselor program. And I give talks and help hospitals and providers think about how to approach the evidence-based interventions that we know help women reach their breastfeeding goals.
Great. So it sounds like you have a lot of experience with this topic, so I'm excited to hear about your insights. What is covered in the Affordable Care Act in terms of breastfeeding?
Well, I think that the Affordable Care Act covers important preventative services, and they recognize breastfeeding as an intervention that improves health outcomes for moms and babies. We don't have a lot of interventions that make a huge difference in terms of long-term health for women and children, and breastfeeding does, and it's one of the reasons it's included. It's important for providers to know that breastfeeding counseling and education by trained providers is covered by the ACA, as well as breastfeeding supplies, so women can get their breast pumps covered by their insurance. So it's really important that you help your patients approach their insurance, ask about what's covered, and that you're getting reimbursed for the breastfeeding services that you're providing.
Mm-hmm. So do national provider organizations have some sort of guidelines for what providers should be asking, how they should approach this topic?
Absolutely. Almost every provider organization group, midwives, family practice, pediatrics, ACOG, American College of OB/GYN, they've all come out with recommendations and very specific what they want their providers to be discussing in terms of breastfeeding. So I really encourage providers to seek out their organizations. If you Google your organization and the word breastfeeding, you're going to come up with what your recommendations are. It's really important that you have a sense of what you need to know. I think that's the most important thing. Everyone knows about the concept of breastfeeding. The hard part is making sure that we as providers know how to talk about breastfeeding with our patients and know why it's important to talk about it. Mm-hmm. And that we're also taking a leadership role in making sure that the evidence-based practices that are so clearly important to helping women in our country reach their breastfeeding goals are in place in your hospital and your office. And that's really important, and a way to do that is to look at what your organization is telling you. So something that's very important to know is the American Association of Pediatricians, the recommendation for duration of breast milk. So the recommendation is 6 months of breast milk with continuation to a year as mutually desired by mom and infant. And I think that's important because women are looking to their providers to get a sense of, should I be breastfeeding? Is this helpful for my baby? And then how long? We're not telling all women how long they should breastfeed. We're educating them about the benefits of starting breastfeeding and the benefits of duration. And there's a lot of evidence to suggest that patients really listen to their physicians. Many patients say the number one reason that they chose to breastfeed and that the duration of breastfeeding was because of a physician talking to them about it. So know what your recommendations are, and it's also an easy thing to bring up with patients. You're saying, what do you know about breastfeeding, and then you're bringing up the recommendation 6 months with a year or more, depending on what a mom and baby want to do. So I think it's helpful to know what those recommendations are.
Mm-hmm. So what are the current breastfeeding rates in the United States? I mean, what do providers need to know about how many people are actually doing this, and what are some of the barriers that women are talking about?
So I think the important thing to know is that most women in the United States want to breastfeed, and certainly women who are educated about the benefits of breast milk for mom and baby, most women choose to breastfeed. We know that about 75%, or 3 out of 4 women in our country, are initiating breastfeeding. So that's great, and those numbers continue to go up every year, which shows how much work is being done across the country to help women learn more about the benefits of breast milk. I think that one of the areas that we struggle with is duration, and that the long-term health outcomes, those benefits of duration, getting a woman to 6 months to a year of breast milk with her and her child, and we have a lot of drop-off. And I think that that's where the barriers that women face to reaching their breastfeeding goals come into play, and understanding those barriers. I think we really need to be able to provide those evidence-based support in the hospital to help women succeed in initiating breastfeeding, but then we also need to support them when they go home. So it's making sure that women have the support and resources to really be able to handle the challenges of breastfeeding, and know that they're supported and know they have someone to reach out to. We know probably the largest barriers for women breastfeeding is education, knowing about the benefits of breast milk, having the services, the evidence-based services and care practices in place at the hospital. Are hospitals routinely doing skin-to-skin? Are they routinely getting women breastfeeding in the first hour? Are they supporting the women during their hospital stay, and then supporting them when they go home? So those kind of evidence-based practices in place, and then making sure that physicians are supportive. Those are all issues that women face. Another barrier that women face is when they go back to work. Some women breastfeed until they go back to work, and that's one of the areas, the reason the Affordable Care Act covers breast pumps. And it's important that as providers, you can help empower your patients to know, what resources are available to help them be successful to reach their breastfeeding goals, even when they go back to work. So making sure that they get a prescription for a breast pump so it's covered by insurance, and making sure that they know what their rights are and how to think about having time and place to pump breast milk at work. There's certainly a lot of support groups that you can refer your patients to that work on these issues, and finding those resources where you practice is really important.
Yeah, I mean, so it sounds like there are several evidence-based interventions that you want people to know about. Are there other things that you feel like providers need to know in terms of the evidence base?
Yeah, so I think that if you look at, ACOG's recommendations for providers, there's the whole part on counseling and educating, but there's also making sure that these evidence-based care practices are in place. And a lot of providers may not know what those are, and what we really need is to have prenatal providers really taking a leadership role in their hospital to make sure that these policies are in place, and that you have up-to-date protocols, breastfeeding protocols in place in your hospital. Some of the most important interventions that are evidence-based, so the BabyFriendly USA has 10 steps, which are really 10 evidence-based steps for helping to support breastfeeding at your hospital. And many hospitals across the country are on the pathway to baby-friendly, and it's one of the U.S. 2020 public health goals is to increase the number of hospitals that are baby-friendly in the United States, and we're really certainly taking off. I know in Illinois, the number of hospitals who are either on the pathway to baby-friendly or have achieved it has significantly increased in the last 5 years. Not all hospitals are going to become baby-friendly, but what's important to know is that those 10 steps, even carrying out 5 of those steps in your hospitals, is going to increase your exclusive breastfeeding rates.
What might some of those steps be?
Yeah, so I think the most important things to think about are making sure that you have a protocol in place. I think that's number one. Making sure that your staff, your nurses, your physicians, everyone's been educated about what that protocol is. So for many hospitals, it's setting up a committee. It's writing your protocol. There's lots of example protocols out there online that you can get, particularly through BabyFriendly USA. Educating your staff and making sure they understand what the protocols are. And then it's a lot of making sure that all of your patients are educated about the benefits of breast milk, that they're educated about how to start breastfeeding, so that there's breastfeeding support available to get women breastfeeding in that first hour or as soon as they can after labor and delivery. There's also the important practice of skin-to-skin. So helping all patients, regardless of their plan to breastfeed, to have 30 minutes of skin-to-skin in the delivery room. Our job as providers is to make sure that patients know that this is a really important benefit for babies to help them transition from being not born to being born, and that being skin to skin is a really important way to help them sort of transition and regulate their blood sugar, their breathing. All those things do better when a baby is skin to skin. So including skin to skin in the protocol is really important. And having physicians who embrace it and encourage patients, oh, instead of having the baby go to the warmer, or instead of having the baby wrapped up and swaddled in the corner with grandma, let's do 30 minutes of skin to skin. It's a big help to you and your baby. So that's a part of it. And then there's the part that we need to be encouraging our patients when they go up to postpartum after they deliver, rooming in, nursing on demand, avoiding pacifiers, and then women who want to breastfeed, we should be encouraging them to exclusively breastfeed. There's definitely a kind of habit. Now this is luckily going out of fashion, but I hear a lot of providers saying, why don't you sleep tonight, put the baby in the nursery, we'll start breastfeeding tomorrow or the next day, you're exhausted. And they want to do the right thing by their patients, and they want to help their patients recover after delivery. But actually you're really getting in the way of the physiology of lactation by not keeping moms and babies together and nursing on demand. We really want to get to our exclusive breastfeeding, and so encouraging moms to keep the baby in the room, nurse on demand, and only give the baby formula if the pediatrician says the babies need it. And some babies need formula supplementation, and we shouldn't see that as a bad thing, but we need to make sure that our patients and our nurses understand that we're using formula for the right reasons and not the wrong ones. And I think when you look at the new JCO core measures, they're really tracking exclusive breastfeeding rates, and they're looking to see in those first 2 days after a baby's born what percentage of babies at your hospital did not get any formula. And the reason is we're doing all these things to help moms and babies be successful breastfeeders. And I always tell moms, we're working on your baby becoming a professional breastfeeder. And we got to do the things that we know are evidence-based to help your baby get there. And the more physicians can support patients rooming in and nursing on demand, avoiding pacifiers, avoiding formula unless they need it, the more we're going to be sending moms and babies home that are professional breastfeeders and helping those families reach their breastfeeding goals.
So it really sounds like it takes providers being committed and being supportive of the practice.
Yeah, absolutely. It's understanding that there are evidence-based practices out there that make a difference, and being a real leader to help embrace them at your hospital. And those aren't just practices that one provider does one time. It's really about instituting a system-wide approach, and that's where these protocols are so efficient. And that's really where BabyFriendly USA and the WHO is really recommending these evidence-based practices. And we know that even moving a few steps towards baby-friendly is going to make a difference for mom and babies. Other interventions that I think the U.S. Preventive Health Task Force and ACOG and the CDC would recommend, it's really about providers educating their patients. It's been shown when they discuss breastfeeding prenatally and postnatally, it makes a huge difference. Another important area is around peer counselors. I've worked on setting up peer counselor programs in the past, and it's incredibly beneficial, particularly for at-risk populations, women who historically may have lower breastfeeding rates. Bringing a peer counselor into your clinic, your office, your hospital to work with women can really see dramatic changes in patients' willingness to think about breastfeeding and then feel supported and engaged and empowered by breastfeeding. And we've seen a lot of teen moms who traditionally folks would maybe not talk, really push that hard. They would have thought, this mom is never going to breastfeed. And by empowering these young women and giving them education and support from their physicians, but also through a peer counselor, we see these women embracing breastfeeding and coming back and sharing stories about how empowered they are to breastfeed. Other areas, centering pregnancy, centering group-based prenatal care, those areas also have been shown to improve breastfeeding outcomes. And finally, I think it just comes back to the provider. I would say the number one intervention is having a provider who thinks about breastfeeding support, talks about it, even if briefly, make sure that they're not just asking breast or bottle. They're really saying, how do we help women be successful breastfeeders? Yeah,
I mean, you mentioned at-risk populations, and it makes me think about, you mentioned teen moms, for example. What advice do you give providers that might say, hey, I have a mom that's very stressed out or comes from a background where there's not a lot of support for breastfeeding. Maybe she grew up in a family where there was some neglect or she didn't learn how to do those kinds of things. What advice do you have for that provider to provide that woman with support?
I hear this a lot when I go around and I talk to groups who say, I work in an area with a population that they don't want to breastfeed, they're not going to breastfeed. Culturally, they're not interested in breastfeeding. They're young. They don't know anyone else who breastfeeds. And I think it only takes one provider to connect with a patient and empower them. And all women want to do what's best for their babies and for their families. And your job is not to tell all women they should breastfeed. That's not our role. And in fact, that doesn't work very well in any area of medicine. But it is a really important role to educate moms about the benefits. And it doesn't matter if this is someone with low health literacy who didn't graduate from high school, who's becoming a mom for the first time and maybe a teenager, to someone who has a PhD. All these women benefit from hearing about the benefits of breast milk. I do think that peer counselors, there's a lot of data to support that in low resource settings, having peer counselors, which is not a big expense to bring into a clinic, they really make a difference. We had a peer counselor program where we had a peer counselor meet with every one of our patients in our resident Medicaid clinic, and we saw really incredible benefits in terms of initiation of breastfeeding. I remember the nurses talking to me on labor and delivery saying, Dr. Borders, what's going on? Because they were getting all these patients in who historically would never have been interested in, who hadn't been interested in breastfeeding in the past, these young women. And they were saying, I need my baby to be skin to skin, and I'm going to breastfeed, and don't give my baby any formula. And they were really empowered by the information. And I think that's the important message, is that it doesn't matter if you've, gone to graduate school or you haven't finished high school. Moms want information about how to make their babies healthier. And our job is to make sure they get that information and that we're getting them the evidence-based practices to support them to reach what their goals are.
Yeah, I think that's great advice. So don't stereotype based on the patient and just think, okay, well, this person isn't going to breastfeed. And also that there's a role for peers in all of this and good evidence-based practice. It's great.
Absolutely. And I think that some areas are able to do group prenatal care, and there's been real evidence to show that group prenatal care and improving that, I think it comes back to education, getting women access to education about breastfeeding. And
that's the process you're calling centering, right?
Yeah, group prenatal care. Yeah. And I think that it's really about getting women access to education, and that's both through providers talking about what they know about the benefits, but also trying to encourage women to reach out to prenatal breastfeeding classes. That's also an important resource. And it's not just the patient. I think this is an important point. You really need to be thinking about the folks around a patient, so the partner, the grandma, and so I often invite, when people are signing up for breastfeeding classes, I really encourage them to bring a support person. It might be their partner, but it might be their mom or their grandma. It can really be anyone. And we've found that by bringing a support person to the prenatal classes, it really helps build that support around a woman for breastfeeding, which is so important for their continuation. And so that's an important piece of it as well. You're not just educating a patient, you're educating a family about the benefits of breastfeeding.
So it's definitely a shift in thinking.
I think so.
Yeah. So what do you think the take-home points are for providers? What do you want them to know about this issue?
So I think that the most important thing for providers is really to understand how to counsel a woman, and that it's important. That we're not saying, breast or bottle, your nurse is going to check a list and then it's on your little sticky that this person's doing bottle, this person's breast. You really need to ask a woman, what do you know about breastfeeding? And then you need to tailor to concerns. If she's scared about pain or she's concerned about what her body's going to look like, those are all things you can talk about with a woman. And a lot of women don't know about the benefits. So making sure you're asking, what do you know about breastfeeding, and then following up. You don't have to have a half an hour lecture on breastfeeding then to follow. You can really say, this is the benefits. Here are some of the key things that can help for you and your baby. reducing infection, reducing SIDS, reducing childhood obesity. It's helpful to you as well, reducing the risk of breast cancer. For women with a family history of breast cancer, this is a really big news to them. I've had women that I've talked to who said, I've had other babies, and my mom died of breast cancer, no one's talked to me about this, that it significantly reduces my risk. Women want to hear that. So I think the education piece and knowing that it makes a difference is incredibly important. I do think that providers also need to understand how to take a leadership role in putting the evidence-based practices to work at their hospital, that they play an important role in making sure that women are skin to skin, that they understand the benefits of exclusive breast milk, that if they're separated from their baby, if the baby goes to the NICU, that it's really important that providers are a part of that conversation, that are helping moms know at the time they deliver, or even on labor and delivery before they have their preterm baby, that breast milk is a really important intervention to improve outcomes for preterm babies. We ask all patients who are delivering preterm, we want to talk to them about the fact that breast milk is medicine for your preterm baby, and that it's one of the key things that we have to improve outcomes for preterm babies. And we ask, will you be willing to pump milk for your baby while they're here in the NICU? And even women who weren't planning to breastfeed, that kind of encouragement and knowing that it can make a difference for their child, typically women will respond and want to try to do something, want to try to pump. A key thing that's important that your nurses and that your physicians and your neonatologists are aware of is that it's not okay to send someone upstairs and say, we'll start pumping tomorrow or the next day, that the evidence and really how lactation works, you really need to start stimulating the breast and start pumping within the first 6 hours after delivery. So we talk to women at delivery, make sure they understand the benefits for their preterm baby, and make sure that they know that we want to start pumping when they get upstairs, and that we want to start pumping regularly every 3 hours. And that's not something that maybe all women, a message that they're getting, and we want to make sure, since it's so important for our preterm babies. And then I think finally, when you are taking care of your patients at the hospital and you're walking in the morning for a postpartum visit, you want to ask, how's breastfeeding going? You just want to touch base. And again, you don't have to be the expert. You don't have to be the lactation consultant. You need to just ask how it's going. And then if a woman's having issues or feeling stressed or frustrated, that you talk about, it can be hard. And that's why we have so many supports here to help you. Let's call a lactation consultant, or let's get your nurse in here to help with your next latch. And we want you to be successful. We have lots of resources. We want you to be successful. So I think that encouragement, asking how it's going, and then bringing in the rest of the resources to help. And then when you send a woman home postpartum, really important that you include a phone number they can call for breastfeeding issues. So you want to either be sending them to a support group, giving them a phone number. They need to know where to go when they get home and they don't know what to do next. Your office staff hopefully can triage phone calls about breastfeeding and know who to call. If they don't know how to counsel about breastfeeding issues postpartum, you need to make sure you have your resources lined up so that you can adequately support your patients.
So lots of good information, both for providers and for providers to educate patients with. Thank you so much for talking to us about this very, very important topic.
Thank you. Thank you for having me.
Thank you.